Most folk believe legalisation is the answer. End prohibition, regulate drugs, and the problem starts to disappear. But that doesn't stack up, because everywhere legalisation has happened, the harm doesn't vanish. It changes shape, markets adapt, power shifts, control doesn't disappear. It reorganises. So the real question isn't whether drugs are legal or illegal. It's who controls them and who pays the fucking cost. And if legalisation doesn't fix the problem, what actually does? Drugs and Addiction, Anarchist Perspective, Dickie Dredd. This is part 70 in the video series in chapter 10, Liberation and Legalisation. Part 71 in the book, Pathways to Reform. Any transition from prohibition to participation must begin locally. As the last section argued, real risk management depends on trust, not control. To move beyond rhetoric, reform must be designed as experiment rather than edict, tested in small, transparent communities and scaled only when evidence supports it. Several UK councils already managed alcohol zones and harm reduction initiatives. The same framework could support locally run drug pilots. Citizen juries or regional assemblies could oversee cooperative supply chains with open data or purity, price and harm outcomes. Roles and Transform outline practical models for phased regulation, from decriminalisation to licensed social clubs, proving that democracy can manage complexity without resorting to punishment. Bolivia's partial legalisation of the coca leaf in 2013 restored a traditional crop to lawful use, whilst undermining cartel profit. Uruguay's cannabis program, initiated in 2014, created state-regulated cultivation and capped prices to prevent speculation. Both examples demonstrate that legality need not equal liberalisation. Control can serve health when detached from corporate capture. These models offer a counter-narrative to the free market paradigm, dominant in Western reform discourse. No reform is free from peril. Black market actors rarely retire, they adapt. Integrating illicit producers into transparent economies will require amnesty, training and microfinance, not merely policing. Pharmaceutical monopolies pose the opposite risk, replacing one cartel with another. Safeguards must include open source research, cooperative ownership of production, and citizen oversight of taxation and reinvestment. Trust, once broken by decades of fear, will be rebuilt only through visible accountability. As Marte reminds us, health is inseparable from relationship. A just drug policy must therefore repair trust at every level between users and state, science and society, individual and community. Legalisation is not an event, but a process, the slow conversion of fear into participation, risk into relationship, and policy into cure. Section 72. Risk without capitalism towards a rational framework. Sorry, I can't get my words out today. Right. Legalisation is not the end of risk, but the beginning of honesty. A credible policy must accept danger as an element of freedom, not as a reason for control. The current framework, prohibition disguised as protection, sells punishment to the poor and indulgence to the rich. A rational model would replace both with reciprocity, evidence guiding care rather than commerce dictating harm. As shown in section 70, the data against prohibition are already conclusive. The remaining task is structural, how to regulate without reproducing hierarchies that may control addictive. Roles and Transform outline a graduated system grounded in comparative harm, echoing David Nutt's scale discussed in section 44. Their approach replaces criminalisation with proportionate regulation. cooperative production for low-risk substances, supervised distribution for moderate-risk ones, and medical oversight for those that truly endanger life. This logic parallels the open source ethic of Section 48, transparency as accountability rather than monopoly. Ownership and control must be decentralised. Bewley-Taylor traced how early international conventions protected imperial trade. Undoing that legacy means localisation. Community cooperatives would replace corporate cartels, and surplus would be reinvested into housing, education, harm reduction. Profit produces a byproduct, not a goal. Bakun and Reuter support this pragmatic pluralism, showing that balanced regulation, tolerant control, outperforms both laissez-faire and prohibition. Fisher et al. Reached similar conclusions from cross-national comparisons, emphasising hybrid models that blend state stewardship with civic autonomy. Such approaches imply cultural rather than commercial reform. As noted in my book One Flew into the Cuckoo's Nest, personal recovery depends on integration, facing the wound rather than denying it. The same principle applies collectively. Prohibition externalises trauma through law, while national reform reintegrates responsibility through participation. The task is not to relive the pain of prohibition, but to metabolise it, transforming vigilance into care. Public resistance, meanwhile, stems less from evidence than conditioning. Decades of propaganda have equated legality with morality. Citizens imagine chaos and freedom because they already live with managed disorder. Friday Night Britain offers the proof. City streets carpeted with the debris of alcohol, the most harmful drug on David Nutt's index, while those who use psychedelics or MDMA in controlled communal settings are condemned as immoral. The contrast exposes the hypocrisy of a culture that worships intoxication when profitable and persecutes it when it's autonomous. Fear persists because it is economically useful. As Bewley-Taylor, Rolls and Stevens document, moral panic finances an ecosystem of enforcement, rehabilitation and sensationalisation. Klein would recognise this as a variant of disaster capitalism, crisis converted into currency. An anarchist framework reverses the flow, replacing extraction with stewardship and outsourcing with mutual responsibility. Risk becomes a shared field of knowledge, managed through peer education, open access research and cooperative regulation rather than delegated control. Recent research supports this decentralised vision. Rhodes et al. Proposed a risk environment framework in which harm is reduced as much by policy as by substance, implying that reform should target context, not chemistry. Measham advances regulated normalisation, arguing that social integration, honest information reduce harm more than effectively than deterrence. Together these models demonstrate that a rational system is not utopian but evidence-based, policy as designed, not dogma. Legalisation without capitalism, therefore, begins where fear ends. Measure harm honestly. Regulate supply democratically. Return profit to the commons. Replace stigma with stewardship. As argued earlier, science gains integrity only when it acknowledges its subjectivity. Policy must do the same. Rational regulation is not indulgence but maturity, the movement from obedience to empathy. The next section extends this logic from governance to learning. If risk can be managed collectively, it can also be taught collectively. A culture educated, at last, to live with freedom. Legalisation doesn't solve drug harm. It just exposes whether the system behind it has changed. Because if control, profit and hierarchy stay the same, the outcome stays the same, just dressed differently. Which means the real issue was never legality. It was who owns the risk, who controls supply, and who benefits from both. So if changing the law isn't enough, What has to change underneath it? And if we're not willing to answer that, are we reforming the system or just repainting it? Next up, still chapter 10, Liberation and Legalisation, section 73, Education, not enforcement, learning to live with risk.